Hello, good morning. Good morning, Laurent. Good morning, colleagues. We're gonna give between 3 to 5 minutes for people to connect. Hope you don't mind.
Edward, you let me know when we should
I
start.
think we can start, Tasha. Yeah, I think we can open the webinar right now. It's 5 minutes past the time, so let's move on. If it's fine, if everybody is ready. So welcome everybody. We're gonna start now the webinar. We are recording, just to mention to everybody. There is an AI transcript that is gonna be shared together with the recording. So for all your information, and I'm gonna hand over now to the opening introduction from Tasha Gill, the global lead of the migration. Of the migration portfolio in UNICEF. Tasha, over to you. Thanks.
Great. Thank you so much, Edward. And many thanks to everyone who has found the time to join us today for this very important discussion. I'm really looking forward to it. Welcome. We're focusing today on the measurement of impact change in the Prospects program. And I want to say a few words just about Prospects itself before handing over to our colleagues to get into the impact feasibility assessment. As Edward has said, I'm Tasha Gill. I'm the global lead for the Migration Displacement Hub. So we lead the cross-cutting work on both migration and displacement across UNICEF. And I'm really pleased to be here today because it's so critically important for us to be able to measure the impact that we make through this work. The focus is on demonstrating how we make a difference to improve the well-being of forcibly displaced people and host communities. And I wanted to talk a little bit about Prospects program, just so for those of you who are not familiar, have that as a backdrop. The Prospects program, we believe, is truly very pioneering and unique in its nature and its vision. It's a multi-year partnership. It was launched in 2019. We're now in the second phase, which runs from 2024 through 2027. And its overarching purpose, its goal, is to improve the lives and the prospects, hence the name, of millions of people who have been forcibly displaced, as well as the communities that receive them and host them. And the program is, of course, made possible, as you can see on the screen, thanks to the vision and the funding of the Kingdom of the Netherlands. It brings together a unique set of actors. As UNICEF, we often work in multi-agency partnerships. This partnership in particular brings together UNHCR, ILO, so the International Labour Organization, but also IFC, the International Finance Corporation, and the World Bank, together with UNICEF. And the Netherlands is a partner in the implementation of this program. We work in coordination with government across 8 different countries in the Middle East, Northeast, and Horn of Africa: Egypt, Ethiopia, Iraq, Jordan, Kenya, Lebanon, Sudan, and Uganda. And the work that we do together with the partners serves to protect, include, and empower. So specifically to boost agency and resilience of forcibly displaced people and their host communities, to improve access to rights and to protection, and to strengthen the national systems that provide those for all people who are displaced and the communities around them. And our work is across many different sectors: education, child protection, social protection, critical infrastructure. So in UNICEF parlance, WASH in particular. And we worked together with national actors, with local organizations, with international organizations, community-led organizations, importantly, refugee-led, youth-led organizations, in order for this work to be taken up by national systems and by communities, for it to be sustainable and long-lasting, to be relevant for the needs and the ambitions of forcibly displaced children and their communities. Some of the ways in which we find the Prospects program to be particularly innovative, some of them are familiar, some of them I think are really groundbreaking. It does focus on solutions and therefore addresses the nexus work, bringing together humanitarian and development work because of that focus on system strengthening and finding solutions for forcibly displaced people. It also breaks down silos, something that we like talking about. This program brings together so many different sectors and agencies with their expertise and mandates. So it leverages the strengths of all of the organizations and our technical areas of expertise. So, for example, bringing together education and employment and protection as one example, in a more integrated way through the program approach. And the last thing that I really want to highlight is the way in which it is committed to and designed in order to innovate, to try new approaches and to scale up what works. So there's a real commitment to exploring what works, documenting that, improving it, and then scaling that up. And so everything from flexible education approaches that now governments have taken up to cash transfers, to matching young people with job opportunities. There's a number of different initiatives that the Prospects program has piloted, explored, and have been taken up to scale by the governments. And so then just in closing, before handing over to focus in on the impact feasibility assessment, I mentioned earlier just knowing what works. And so the focus here is on producing that evidence of what works. And this is more important than ever, I would say, in these contexts, but across the board. It's not enough for us just to take action and be accountable for those actions, but we have to learn from those actions. That's part of the accountability, and to share that learning, to understand what works and why, in order to be able to do that scale up that we mentioned. So today's webinar is dedicated to that piece of this work, of that commitment, which is to deepen our shared understanding of the evidence, the learning, the impact, to make sure that every action we do take, we know is proven to have an impact to improve the lives of those we are committed to serving. So thank you very much for being here today. I hope this is going to be a very useful session. I'm very much looking forward to it. And I want to thank Edouard and hand the word back to him. Thank you.
Thank you very much, Tasha, for your opening words. Let me see if could you please confirm that you can see the presentation?
Not yet, but I see you very well.
No. Not yet.
Yes.
Oh yeah. Oh,
Yes.
Okay. Good. So then I'm going to take 5 minutes, 6 minutes just to introduce a little bit the topic, and then I'm going to hand over to the team of experts that conducted this, that led this exercise. So let me first tell you what is the continuing the what Tasha just mentioned on the relevance of evidence, not particularly in connection to prospects. More in general, in the Evaluation Office of UNICEF, we are conducting this type of exercises, what we call impact feasibility assessments, for multi-country, particularly programs. But basically, what lies behind this is the need to help to contribute generating evidence, evaluating outcome and impact change, of programs, contribute to that to happen. And mostly there are several reasons to do that. Tasha started mentioning about this, but basically there are intrinsic reasons and instrumental reasons, one could say. Intrinsically, there is a moral imperative to do so, because what we want is to do certain, we are committing to improve the lives of the population, children in this case, in the case of UNICEF, mostly, and families and communities. But there are also instrumental reasons to do that. So the idea is that we need to take evidence, and we want to take evidence-based decisions. So we want evidence to be available, and not only available, to be used. But whenever it's not available, we need to start producing it. And what we would like is to have, as a desiderata, is to have the best evidence possible, or that at least would be what we aspire for. So when we have it, we would want to use it, we must use it, and we want to promote and advocate for it to be used. And this is for different reasons, because we want to learn on what works, we want to expand and scale what works, but we also want to learn on what does not work, to do things differently, and to not repeat it. And particularly, this is relevant, very relevant in the current context where we are now, that international aid for development is in some areas, in some spaces, is questioned. So this is more important than ever now. And let me move on. Linking also to what Tasha mentioned, this is just to give a very brief high-level overview of prospects, of the current phase 2 of prospects, which runs from 2024 until 2027. And you can see that the partners, funding and implementing partners, are listed on top of this slide. And the exercise basically is going to focus on on the role of UNICEF in the partnership. So this impact feasibility assessment, although like the program of prospects is not conceivable on a solo basis, is designed to be a partner program, a partnership program. This exercise is led, is commissioned, is driven by the impetus of UNICEF side, but it has been done thanks also and in collaboration with several others. Let me show briefly and without entering into detail who are these others. So basically, there is an independent experts team that is going to lead this presentation today. And they are Preksha Golsha, the team leader of the team, and Jose Giarola, that they conducted the impact feasibility assessment of prospects. This exercise was commissioned by the Migration and Displacement Hub of UNICEF, led by Tasha Gill, Rhonda Fleischer, and then it has been managed by myself, Eduard Bonet, and Innocent Cava from the Migration and Displacement Hub in UNICEF, and myself in the Evaluation Office. Now, all this has been possible thanks to the interaction and at different levels and through different functions and roles, not only of UNICEF program colleagues, but also evaluation colleagues in UNICEF, and also through them in the 8 country offices of prospects. This has been possible thanks also to the contribution, the feedback from prospects partners at HQ level mostly also. And I should include here not only the implementing prospects partners, but also the evaluation function teams. And we are really thankful for those, because genuinely this helped improving the process and the product. Then just before this is the second last slide that I will share with you. What are the key elements, the key points of the impact feasibility assessment that we conducted for prospects? The first one is that this is an exercise that zooms in down at a project level, at micro level. So prospects, as you might have heard, is also is a very ambitious program, as Tasha mentioned, and tries to bring in policy level change at institutional level in the 8 countries of the program. But this is also done through pilot programs, pilot projects that are meant to be scaled up, demonstration projects, and there are other types of situations and exercises and contexts that require that implementation takes place mostly at project level and intervention level, we call it. No, this is the focus of this exercise. The exercise is also looking forward, because it meant to learn, as I mentioned before, on what works and what does not work, so we can be ready and we can understand where to invest to scale up interventions. The impact feasibility assessment, this exercise, is also meant to help us, the practitioners and UNICEF, and also the partners in prospects, to generate momentum, to generate an opportunity to discuss and to identify what is worth to refine in terms of the program, what is worth to prepare better for evaluation afterwards. But also it's a process that helps us raising awareness and mobilizing demand for this type of exercises, for impact evaluations that, as you know, are very costly, very in terms of investment of time and resources. So we better want to be very wise, particularly now to allocate the resources for this type of exercises. And then finally, the idea here of this exercise is underpinned by the promotion of generating rigorous evidence wherever and however is feasible. Now, finally, before handing over to Preksha and Jose, the impact feasibility assessment is an exercise that, building on the methodology that was developed 2 years ago in the Evaluation Office of UNICEF, also in collaboration with NFPA, for an impact feasibility assessment of the global program to end child marriage, has been replicated and adapted in other contexts, in other programs. And uniquely now in prospects, we're applying it because prospects offers a particular challenging context or environment, not only because of the nature of the program itself and how ambitious it is, but also because of the different contexts where prospects is operating, is being unfolded. So the impact feasibility assessment consists of 4 stages. Basically, first, there is a rapid review of literature on what works, focusing on what works in the countries of interest. In this case, the 8 prospects countries, which are the countries in Eastern, South Africa, and North and Middle East. Let me mention them just in case somebody that's not on top of the list. I can go back here to the slide. So the countries are Uganda, Kenya, Ethiopia, Sudan, and then Egypt, Jordan, Lebanon, Iraq. So you can go geographically follow the path, the route. So then the rapid review of the literature on what works basically tries to identify what do we know and what do we not know when we look at the recent available literature for these particular populations, forcibly displaced populations, and host communities that Prospects is focusing on. The second step is consists of scanning all the interventions, all the projects in the 8 countries of Prospects to identify which ones are good candidates, good interventions, good projects, where one would be able to decide to make the big investment that requires to conduct impact evaluations. The third stage is consists of conducting the exercise, to go in depth and understanding some of these projects. In this case, it was 4. The ones that are in the best position following the second stage, and design for those an impact evaluation. Only design, not starting. And then finally, the exercise just wraps up and extracts lessons learned and conclusions that Preksha and Jose are going to share also with you now. So without adding anything else, I'm handing over to our expert team. Preksha.
Hi, everyone. Good morning, good afternoon, where you are, and thank you so much for joining us today. I'll take us through. I'm Preksha. I'm a lead social policy advisor at the Economic Policy Research Institute and a team leader on this assignment. I've been supported by Jose, who is a senior social policy advisor at EPRI as well. We've put together this report with a lot of support from Edward and the team, and we look forward to sharing the results with you today. I am going to start with the stage 1 of this evaluation. We had selected the primary goal of the stage 1 report, the S1 report, was to conduct a thorough review of existing evidence to identify the evidence gaps, which will later help us inform the kinds of interventions that need to be evaluated. The way we conducted this process is we had a very strict selection criteria for the evidence that we would include in this review. As Edward already highlighted, our goal was to focus only on the 8 prospect countries, and we did not expand the search any further. It was also incredibly important for us to ensure that all the evidence we reviewed were strictly linked to and referred to forcibly displaced populations, so refugees, internally displaced populations, and host communities, because the Prospects partnerships focuses on their resilience building. We ensured alignment with the Prospect 2 theory of change. So we looked at the 4 pillars of the Prospect 2 that you will see in just a minute and looked for evidence that would link to those thematic areas and goals of the Prospects partnership. We focused primarily, and I say primarily because we later expanded this search, we were trying to focus only on rigorous quantitative evaluations. So we wanted a quasi-experimental or experimental evaluation to have been conducted for it to be included in the review. We were also initially planning to limit our the time scope for this evidence review to evidence that was generated between 2019 or published between 2019 and 2025. However, we had to ease both the second and the third criteria because we found very limited evidence with these criterion. For countries like like Iraq and Sudan, where we did not get enough evidence, we had to actually expand the scope. So we not only looked at evaluations from 2019, we actually went back to 2015 to look for additional evidence. We also then looked at evidence that was generated by the prospect partners and UN agencies to expand the evidence review because of the limited number of studies we had in the review. Now, how this review was conducted, it was in 3 stages. We began with a review of systematic and critical reviews, using that as the basis and foundation. We expanded our search then to more targeted country-specific searches for evaluation reports, for studies that were done to try and identify anything that had been published in this time period. Then we added UNICEF and partner evaluations to this mix. Now, when we added UNICEF and partner evaluations, we did not include only rigorous quantitative evaluations. We eased that criteria to look at any kind of evaluation that was done. On the slide now in front of you, sorry, I don't know who the presenter is. Edward, are you presenting this? Sorry, I'm just trying to see if everybody can see the same screen.
Yeah, there is where the S1 methodology literature review slide.
Sorry, if you could take us to the next slide, please. Thank you. So you'll see on this slide in front of you, on the left-hand side, the original number of searches or original number of results that we had from the search, and then the results from the expanded search. What we found that particularly for pillars 1, 2, and 3, and particularly pillar 2 and 3, we had a lot more evidence that was added in the expanded search. But for pillar 4, which is critical infrastructure, we still had very few results. You'll see all the reds talk about 0 results on the critical infrastructure pillar in the original search, and between 1 and 2 studies in Lebanon and Jordan as part of the expanded search. You'll also note that for Sudan, across both options, there was no evidence that met the criteria. Even after easing the rigor criteria, even after expanding the time scope to cover studies from 2015, we were not able to find studies that were conducted for prospects, pillars, and objectives among forcibly displaced populations and host communities. Now, on the next slide, you'll see we present the key gaps and opportunities that we found as part of our review. All the boxes in yellow are the evidence gaps, and everything you see in blue shows you the opportunities for further evidence generation. Now, from a strategic standpoint, we found that there were few to none no evaluations of integrated multi-component interventions. So in many of these countries, multiple agencies, or sometimes even the same agency, may have been implementing several interventions that could contribute to a common outcome. However, when these were evaluated, if they were evaluated, they were being evaluated in silos, not as an integrated package that could generate stronger, longer-term results potentially. We also found that while prospect partners and others in these countries had implemented innovative delivery models to overcome delivery and operational challenges, these were not assessed. Their added value, the implementation fidelity of these models had not been assessed rigorously. We also found that in many cases where these evaluations had longer-term objectives like resilience building or long-term employment generation, these programs were evaluated over a shorter period, which meant that these longer-term outcomes had not been evaluated. So looking at the systems level change that took place, the more systems and systematic changes that would have structural impacts were not evaluated as part of these outcomes. Often short to medium-term outcomes were being evaluated. From a geographic standpoint, we found that for Sudan, there were no studies at all. There was a clear evidence gap. And even Egypt and Iraq had very limited studies. Now, the common thread between these was the complexity of the situation. The more complex, the more limited access there was, the more security concerns, the lower the number of evaluations or studies that were conducted. We also found, even in countries like Ethiopia and Jordan, where there were significant numbers of evaluations, there were pockets that were not covered. Now, programmatically, we found across all 4 pillars, that there was opportunity to look at more longer-term outcomes and more integrated evaluations. On the next slide, you'll see we're going to take us to stage 2, where we focus on the selection of countries and the interventions that we selected for designing the impact evaluations. The following slide shows us the criteria and the scoring criteria and the ranking criteria we used. Now, we looked at the countries, the 8 prospect countries, and ranked them across 5 thematic areas. There were about 12 indicators in this. We looked at political interest and will, operational facilities in the country, evidence gaps, national data and evaluation capacity, and the burden and the progress that had been achieved on key outcomes based on the evidence we reviewed. In terms of the intervention selection within these countries, when we had to identify which interventions are most feasible to evaluate or most important to evaluate, we had a set of 6 criteria. 3 of those were technical feasibility criteria. So is the program scalable? Then we would like to conduct an evaluation. It's a favorable program. If there is an existing or planned or previous impact evaluation already, we would want to deprioritize that. And again, if there is scope for future expansion where there is government or partner commitment to the program, it would be scored higher. We also included 3 subjective criteria which focused on what we wanted to get out of this evaluation based on prospect priorities. The first clear area was to ensure that we were looking at programs that filled a critical knowledge gap that was identified in the S1 report. It was really important, as Edward had already spoken about, it's important to look at integrated programming and to ensure that we are looking at programs that have multiple partners involved in implementation, because those two are at the crux of what Prospects is about. On to the next slide. You'll see the most favorable countries that ranked out of the ranking that we did were Uganda, Ethiopia, and Jordan. The countries that scored the lowest were Sudan, Iraq, and Lebanon. In the case of Iraq and Lebanon, we also had other challenges. There were no qualifying interventions in Iraq, either because we didn't have sufficient information in the data that we had available, or interventions that we had data for were primarily UNICEF-led and did not meet the multiple partner criteria. In the case of Lebanon, we had 2 qualifying evaluations, but they already had planned impact evaluations, so that was already excluded from our review. We ended up developing evaluation designs for Uganda, Ethiopia, Jordan, and Egypt. Now, the programs that were selected you see in front of you, we combined multiple activities that multiple partners were implemented into packages of interventions, and we designed evaluations for the packages of interventions. In Uganda, we focused on learning to earning, so it's a multiple component intervention combining education as well as skilling sort of interventions. In Ethiopia, it's a cash plus community-based health intervention combined together. And we have in Jordan an education-focused program that combines both in-school and out-of-school measures for developing or strengthening retention in education. In Egypt, we chose a program that was focused on enhancing protection environment for in the education sphere to improve learning through capacity building of the education sector, but also through cash grants, improving accessibility and WASH interventions to improve uptake of education. Now on to the next slide. You see in front of you, the next slide, please, the outline of the evaluation design. Now, each of the 4 evaluation designs have all of these components integrated within them. We highlighted not just the rationale for the evaluation, but also very clearly articulated the impact pathways, what was being evaluated, what the key evaluation questions were, and then provided 2 to 3 evaluation design options, which we'll talk about in a minute. These evaluation designs have outcome indicators, timelines, analysis methods, as resources for data collection, as well as ethical considerations included in these design plans. On the next slide, I want to take a minute to focus on the evaluation methodologies we prioritized. We wanted to make sure that each of these evaluations is a mixed method evaluation, and that was a non-negotiable. Now, the qualitative component was to focus on how change was being brought about, why certain interventions worked, what worked, why it worked, how it worked, looking at the contextual factors, focusing on implementation fidelity, and really trying to understand those pathways of change as to which part of the change led to the change in outcomes. On the quantitative side, the primary criteria was to ensure the most rigorous evaluation design possible. Our top priority thus was a randomized controlled trial, which is considered gold standard in evaluations. We also had to look at quasi-experimental designs where a randomization would not be feasible. Now, the key difference between an experimental and a quasi-experimental approach is really that in the case of an experimental design, we have no observable or unobservable bias. So the treatment and comparison groups can be treated as equal before the intervention. In quasi-experimental interventions, where we use statistical matching methods to make sure that at baseline, the treatment and comparison groups are not different from each other, there is a risk that there may be non-observable biases, things that we cannot control for or see or manage statistically. That's the key difference that changes the level of rigor between experimental and quasi-experimental designs. We were trying not to use non-experimental and retrospective evaluations, but in some cases, we've had to look at retrospective single difference evaluations because of certain programming constraints that we'll talk about in just a minute. Now, each of these do have qualitative components that we don't discuss in a lot of detail at this stage. On to the next slide. You see a snapshot of the evaluation design options we have offered for each of these countries. Primarily, the first most preferred option is a randomized controlled trial. Jordan stands out, and I'll talk about that in just a minute. But except for the case of Uganda, where a quasi-experimental evaluation was not possible because of the programming structure, we looked at a retrospective matching for Uganda as the second option to an RCT. In each of these cases, in the evaluation design documents, we've provided caveats that will help the country office understand which of these options may be most feasible based on the actual implementation plan and rollout plan for the interventions. If you take us to the next slide, I'll talk about the case of Jordan and how, in the case of Jordan, we were able to really offer design options that would be most rigorous. So we looked at a stepped wedge cluster randomized trial. What it just means is that in Jordan, the program that we've selected is being implemented in different phases. So not all the beneficiaries, potential beneficiaries, will receive the interventions all at once. There's in phase one, a certain percentage of the beneficiaries receive the benefit, then it is geographically expanded to other locations, which allows us to use this expansion plan as potential comparison groups or control groups. This is not the case in many of the other countries. This also highlights the importance of being able to plan evaluations alongside programs, implementation, rollout plans to preserve the rigor of evaluations. Sometimes, and in many cases like Egypt, parts of the evaluation, parts of the intervention have already been rolled out, either in prospects phase 1 or now in prospects phase 2 already, which means we don't have these options available. And in most cases, it's a universal rollout, so you don't have a phased approach that you can leverage for a more rigorous evaluation. On the next slide, we'll focus on 6 or 7 key lessons that we have learned as part of this IFA process, which we hope will help strengthen future evaluations. The first thing that stood out for us was that the country selection framework, the scoring of the countries, really overweighed the political willingness and local capacity and did not sufficiently weigh the needs and the gaps in evidence that exists. This is visible as Sudan stands right at as the least favorable country when it is one of the countries that has absolutely no evidence in the evidence review process. But because of the selection criteria and the weighting, we weren't able to identify Sudan as a potential evaluation candidate. On the next slide, you will see that we conducted a quick test to see what happens if we change the weightage of these criteria, if we remove some of these criteria. And we found that the moment we remove national evaluation capacity as a criteria, and we reduce the weightage given to political willingness to utilize the evidence generated, Sudan was among the top 3 countries as one of the most favorable countries for an evaluation. So it's important to consider this as we identify countries that are most favorable for evaluations. Thank you, Edward. Moving on to the next slide. We saw that we had a lot of focus on the most rigorous evaluation design, right? RCTs were the most preferred option across the board, across the stakeholders we spoke to, and that's why prioritized in these evaluation designs. But we also found that RCTs are often infeasible and unethical in these contexts, not just because forcibly displaced populations just face extreme vulnerability. In these contexts, UNICEF and agencies like UNICEF cannot roll out a randomized program. We cannot randomize treatment in these contexts. It would have significant impact, not just on the program's ability to generate impact, but also on things like social cohesion. In these cases, it is important to balance rigor with field reality, to trade off some rigor with a more quasi-experimental approach or investing in looking at more innovative approaches to make evaluations rigorous in the most complex contexts. And understanding fit for context methodologies is really critical. Otherwise, we will promote evidence deserts like Sudan. Moving on to the next slide. It is really important to not forego complex evaluations because of their complexity. The added value of incorporating and looking at integrated packages and evaluating the impact of complementary interventions is critical to enhance more partnership-based approaches in programming. We now know that partnership-based approaches, combined and clustered interventions tend to have higher impact potential, yet these interventions are often evaluated in silos, not looking at the added value of the integration. Therefore, it is important to ensure that integrated interventions have integrated evaluation approaches. And in order to do that, it is critical to ensure that evaluations are planned at the programming stage, joint theories of changes are developed, and these kinds of things are pre-thought before program rollout. Moving on to the next slide. One critical challenge we faced is as part of these evaluation designs, we weren't able to incorporate social cohesion as a key outcome indicator. While we have made provisions for this to be included when more program information becomes available, at this stage, we did not have a breakdown of the composition of beneficiaries, what proportions are host communities, refugees, or IDPs, but to be able to see the impact of these interventions, not on these individual communities, but also on how they interact with each other. Social cohesion is fundamental to success in these contexts, especially for peace building. Now on the next one on feasibility and program design. We've seen this before in the previous slides, but timing is everything. When evaluations are not planned alongside program design and alongside program implementation plans in particular, we lose out the opportunity to conduct rigorous evaluations. When interventions have been rolled out or are already universal, it makes it harder to design experimental evaluations. Moving on to the next slide, the IFA process in particular, and this is the last lesson that we learned and we believe is incredibly important for institutions like UNICEF and others. The IFA process offers a significant opportunity to catalyze institutional learning, to build capacity for more rigorous evaluations, even from a programming lens. It will enable programming experts within these agencies to interact better with evaluation experts and to be able to see an evaluation potential. Even if evaluation designs are not developed at the end of an IFA process, it is a critically useful tool to understand where the evidence gaps are and to promote systems thinking within the organization. So we are building and generating evidence that is most useful, most lacking, and feeds into both development of more rigorous and relevant programs, but also in the most efficient manners. Thank you.
Thank you
Over to
very
you.
much, Praksha. And Jose, I think this has been a very clear presentation. Let me move on, and then for the opening the floor to everybody, and I will hand over to Innocent Cava, my colleague, to direct and facilitate this almost 30 minutes we're gonna have. So over to you, Innocent, and anybody else, any of the participants that would like to comment or ask anything. Over to you. And Innocent, I think you were having an issue with the camera, I guess, and the mic. I guess that now you are fine. Donatien, somebody. Okay, thank you. Donatien, it's over to you. You can turn on the camera and the mic if you want, or just simply talk or just type your question on the chat. Over to you.
Okay, so thank you, Edouard, and thank you to this wonderful presentation. So I really love the all this work through the methodology. It's very interesting. But my humble opinion is that when I look at the audience, there are many people who are not of evaluation background. And I find this presentation quite specialized for a very particular audience. Even a good evaluation specialist might not get it very right because it takes us to a very high level of skill evaluation people. So my point is, like, if we have three things to communicate to our colleagues who do not have evaluation background, what are the key three messages we want to bring out of this presentation? It's very important because at the end of the day, there should be some sort of alignment between the methodological rigor and the very critical message that we want to take forward to our senior leadership and to various audiences. So let me know what are the three key takes away for non-evaluation people attending this webinar. Thank you.
Thank you very much, Donatien, for this very good intervention and question, provoking question. Just let me ask 1 second, Innocent. You wanted to open the floor to Ken. Okay, just 1 second. And if you want, Praksha and Jose, if you want, you can start answering this while I'm addressing this issue, this technical issue here.
Sure. Thank you, Donatien. It was thank you for bringing that up. If I were to identify three key things, and it would depend on the role that the people are playing. You know, if you are a programmer, if you are involved in the programming of interventions, if for forcibly displaced persons, I think the biggest lesson is at the time that the program is being designed and when the implementation rollout plan is being designed, it is really important to design the evaluation at that time. To think about how you're going to evaluate this. What do we want to evaluate? Do we want to evaluate the impact? Do we want to evaluate whether the package of interventions is correct? What do we want to evaluate? Understanding that and making sure that we have key grounds covered, right? And if you look at the evaluation designs data, you'll see we talk about things like if you want to evaluate impact, there has to be somebody who is very similar to the target population that you're reaching. So people that you're giving the benefits to whom we can compare, right? If we need to have a comparison group in order to be able to say that this program works, because there's this group of people who didn't get this intervention, and there's a difference 5 years later between where they are and where people who received the interventions are. And they have to be very similar to each other at the time of program implementation. So that's the first thing. The second thing I would say is social cohesion, right? I think in forcibly displaced persons context and in these conflict affected settings in particular, and increasingly in today's time, it's really important to make sure that irrespective of what the program is trying to achieve, if it's education, if it's WASH outcomes, social cohesion should be an important metric being evaluated. We should always look at the impact our intervention has on building social cohesion across the various groups involved, host communities and displaced persons. And the third thing perhaps I would say is looking at this process of the IFA, at least for us, was a great one. It was a deep learning experience to understand where these huge gaps are. I wouldn't have for a moment thought that there are no studies on forcibly displaced populations in Sudan that would be rigorous. It was very hard for me to fathom that as well. And now it becomes increasingly more important to recognize and address that. So conducting this thorough evidence gap analysis and then looking at, what can we fill, where can we add value before just evaluating something, I think is an important one to remember. Thank you.
Thanks, colleagues. Just to say, I'm back to facilitation, and I see 2 hands. Over to you, Laurent.
Thank you, colleagues. I hope you can hear me well. Indeed, I want to echo the appreciation for a very thorough presentation of the methodology you've been using and how you have approached this discussion on how best to measure improvement in the life of forcibly displaced people. The question I have is about our collective work on system strengthening. Across the different pillars, I'm looking at it from a child protection perspective, but I assume that a lot of what I'm about to say would apply to other sectors as well. A lot of our work is indeed to ensure the delivery of services to forcibly displaced people in an inclusive manner so that we have an impact on their life. Having said that, a lot of our work is also on strengthening elements, pieces of national systems, to advance inclusion. Some of that has to do with advancing legal policy framework, aligning them with international instruments, etc. Obviously, this cannot be measured through randomized control trials. So I'm keen to have your views on how best to measure the impact of this type of work, given that we found it very instrumental in engaging with donors when advocating for system work. And our argument is always the same. This is about scale and this is about sustainability. This is why we are working on system strengthening. Therefore, demonstrating the impact it is having on children in a convincing manner beyond
the traditional randomized control trials that were designed for a completely different purpose, completely different type of work, would be super useful. Thank you.
Thanks, Laurent. Over to you, Sarah.
Could you go back to the slide where NECD was zeroed out? I just want to look because so I'm an evaluation specialist in a conflict context. As such, it's not this one, not this one.
Which one, Sarah?
The one where NECD, where there was a zero, like when you removed NECD from the.
Ah, okay.
Yeah. Yeah. So the issues around here, like these are NECD here is so linked to favorability of political interest and will. And so, like, for example, for me as an evaluation specialist in a conflict context, it's 0% surprising. There's no studies on in Sudan, right, on forcible displacement. And so, you know, when we're looking at impact, a lot of the methodology is driven in no way by, you know, by no methodological concern whatsoever, but just whatever we can do, right? And so I think, you know, I think there needs to be maybe like a little bit more contextualization of the of how strong a factor political interest and will is, because it doesn't, like, here in our region, it's very, very aligned with how functional research is as a, you know, piece of society, right? It's absolutely aligned. Easier to do, like if you look at these numbers, it's very closely aligned with how research is to do generally, and some the other factors are almost, you know, they're almost not, they don't matter, right? They don't matter. And so I'm just sort of wondering how this plays into design, because right now, for example, I have to come up with a control group right now for an impact evaluation I'm doing, and we're not, like, the program is not rolling out in phases. So, right. And so some of these types of issues are, you know, like I said, we're going to choose almost entirely whatever we're told we are allowed to do. That's what we're going to do, right? And so the other pieces, it just, they don't even matter at some level in terms of, you know, you either get an evaluation that's allowed or you get an evaluation that's not allowed, right? And you sort of have to adapt to what you're allowed to do, if that makes sense. Thanks.
Thank you, Sarah. So Preksha, we do have a question from Conchit, Ethiopia. She would like to understand why you have identified social cohesion as an important component, particularly for protection and peace building processes for forced displaced communities who do not have shelter and live in volatile and conflict settings.
So can I just take all three questions at once?
Sure.
Okay, so let me start with the first one. So on evaluating things like that are more systems level changes, you know, a policy reform, a legal reform, most certainly an RCT doesn't work, right? I mean, the only ways of looking at impact of those is going to have to be once a law or a reform is done, right? Which can take a very long time in itself. And I think the challenge is more advocating for having that kind of, you know, 5-7 year investment period for change to occur, because that's the advocacy period. And that's where an evaluation is unfortunately unable to support that process. That either comes from some kind of an inaction study, you know, and one example I'll bring out from this prospects partnership as well. There's some countries where, you know, some of the outcomes are on employment, but legally, you know, displaced persons or refugees are not allowed to work. in those countries. So there is a clear conflict, and for the donor itself, ensuring that there is legal and policy work included as part of this intervention package, as part of the prospect partnerships, becomes critical, right? So one way to get that advocacy in would be to partner it with an intervention, and then use that intervention to say we can't bring about this change without the legal and policy reform work that is necessary in order to allow these outcomes to be achieved. Or the only way to evaluate is once after a reform is done or a law is passed or a policy is changed, to look at the immediate before and after impact. Sadly, the time duration you would have to cover, depending on the law of reform, might be a 20-year time period, 10 years before and 10 years after a change in a law regulation. So it does put us in a tricky situation, but is that really a place where we want an evaluation, or is it more advocacy focused work that is not an evaluation intensive advocacy, but more other evidence generation, looking at, like I said, the cost of inaction and those kinds of pieces, depending on the kind of legal reform or policy reform you're looking at. So I would do a comparison studies, a case comparisons could be a good way to look at that, to build that necessary evidence to support that, I suppose. Now, coming to the second question, completely agree with you on, in some cases, there is just no way around, right? There is what you're permitted to evaluate, and there is no way around it. Situations like Sudan, Yemen, we've seen that before, where everything goes through a stringent review, national review process, and then nothing else gets through. And I think in those cases, we are just constrained, right? But if there is an opportunity to not do an evaluation, to do a functional review, to do that's where the rethinking rigor comes in. Does it really have to be a full-blown evaluation, or can we pitch it some other way? And in those cases, I think it just has to suffice. Some evidence is better than no evidence. And that's the case, kind of, we were saying that through the IFA process, we focused a lot on, it means, let's prioritize an RCT, but there are situations where that will just not be feasible. But the third question was around why we've identified social cohesion as an important component. No matter the thematic priority of a program, in these contexts where host communities, displaced persons live in the same locations, have shared resources, while one group has greater obligation, whether it comes in the form of taxation or whatever it is, while another community doesn't have that, no matter in how much more vulnerable they are. In those contexts, it is really important to ensure that an intervention is not just being provided to, to displaced persons, excluding host communities. Are we implementing our intervention in any way that could exacerbate existing tensions between host communities and displaced persons? I think that's the reason we want to bring social cohesion in, that no matter what your program's impact outcome is or impact indicator is, it's important to look at what unintended effects even you're having on social cohesion. So to have that in the purview of your evaluation when you look at the achievements of the program. I don't know if that answered your question entirely, but I'd be happy to clarify if you need.
Sure, and Edward wanted to come in. Can you just come in, Edward?
Thanks very much, Innocent, and thanks, Preksha. Just to add, I just wanted to complement. Let me take the last point that Sarah raised, and I fully agree with Preksha also. But so the team conducted also this sensitivity analysis that we are just only showing here one element of it partially. Now, in the publications that I shared the link, and I will put it again here, you will see that the full sensitivity analysis, where they compared. They looked at also switching off, how the ordering, how the prioritization of countries would change if you would switch off some other of the elements. And true, they are both very correlated. The national evaluation capacity and operational access or political interest and will. And I think that's precisely this has been one of the from my point of view, one of the interesting results of this exercise in prospects. So basically realizing that we have this solid methodology that we have been unfolding and applying for the impact feasibility assessment. that is adequate for certain contexts, for certain purposes, but not for these ones, because basically, or at least not the way that we were applying it, we have to look at how we weigh the different factors if we don't want to penalize the production of evidence, particularly in those areas where it's mostly needed. So that's a very good point, and I think the point here was to acknowledge this, and that we learned this lesson also, and also to make the plea for an investment broadly to start taking place in investment technically, and also in broadening the acceptability among the evidence community and the evaluation community also of different types of evidence for particularly this context, and I think this has to start happening by testing, by practically working on this. We are having conversations already in the context of prospects with evaluation offices of UNHCR and ILO, precisely on this line. So hopefully something might come out of this. And then just to comment also on Laurent's point on what about systems change, yes, fully agree, and nothing to say to what Preksha commented. I would add to that just one that to try to contribute to measure this outcome impact level change at systems level, let's say, we are also doing an exercise. We just prepared an evaluative baseline document, a report, that goes in line with what Preksha did, what mentioned. The idea is that at the end of the prospects phase that is now going on, 2027, this report that has just been produced also by Preksha and Jose will allow to look backwards. It will be a reference, a snapshot on how is the situation right now, policy level and at systems level, and do the assessment on what changed. Basically, do pick us an end line at 2027 and look backwards. We are also discussing bilaterally with some countries on how to document also some system change and that is taking place already and is on the way of taking place. Let me give an example that it's also very difficult to capture. It's not possible to be captured with RCTs or with these approaches. One example is for the case, for example, in Kenya. There are conversations between UNICEF and UNHCR there on how to accelerate within prospects, on how to accelerate the handing over of the institutionalization of the WASH management refugee camps and handing over to the government, to the counties, And this is quite accelerated, quite advanced. This discussion. I'm not saying that there is going to be a handover soon, but this is very likely to happen. So this is the type of change, of systemic change, that is really critical and important also, and it can basically simply be documented at the very least, minimum. So, but that's a different type of approach. Fully agree, Laurent.
Thanks, Edward. We had one additional question from Conchita again. It says, did you find out the strong factor of political will and interest in influencing the methodologies, and were there any adaptations? And then we have 4 other questions in the chat box, and I'll read them out for you, and we see who takes them before I take the hand. So the first question is, how did you achieve a fine balance between achieving your evaluation with the risk of overburdening displaced populations if we take into account their vulnerabilities and perhaps even survey fatigue? The second question from the same person is, how do you prevent duplicate data collection that may already be happening elsewhere? And the third question is, how will you disseminate the results of these highly complex multi-arm evaluations? Are you open to more innovative formats like Python powered dashboard, storytelling, to make sure that the results remain actionable and accessible to all involved in this initiative? And the fourth question is, any plan to standardize how these results will be communicated across countries, assuming we want to compare across? And then maybe I can pick on the hand. Can you come in, Jafte?
Yes. Good afternoon, good morning, colleagues. Interesting conversation. I mean, let me first say that I'm not an evaluation specialist. I'm more of a program person. And I really would like to hear, because when I mean, the title is impact to improve the life of forcefully displaced persons. The question I really have is, considering really the vulnerability of these displaced people, and knowing, I mean, when we talk about impact here as program people, we know that it's something that comes with time. It comes with time, and especially if we put impact on the lives of people. So my question is, how do you determine the moment of that evaluation, considering that these people are in a situation which may be volatile, may change at any time, and it's also depend on what created the situation that led to them being displaced. So many variables going on here, and really I'm curious to know at what moment or who decides the timing of evaluation for this specific category of population. And maybe linked to that, to what extent would you say your conclusion of such an evaluation will really leave the test of time? For example, I mean, you can have an evaluation today of displaced people, and maybe in the next 2 months the situation changes. How do you do? So I'm really curious to hear about that. Thank you.
Thank you. Preksha, maybe I go through 2 more additional questions before you guys take on, and then we are only 3 minutes away from the end. So I also wanted to be guided whether we are looking at slightly extending and complete the Q&A, or we want to, wrap up and jump into the closeout.
I think we can go from my side a couple of minutes beyond, but I would not extend much more to be mindful of the time of everybody. Thanks, Innocent.
Okay, so there is a question from Maha: how to address topics such as gender equality and disability inclusion to ensure these are captured. We are working on outcome mining methodologies and wonder if this could be integrated into these exercises. This is from Maha Mona from Jordan. And we had a question, so I'm jumping from one place to another. So I'm trying to jump back to a question from Konjit. One moment, I just read it out for you. I would like to understand how you have identified social cohesion as an important component, particularly for protection and peace building process for forced displaced communities who do not have a shelter to live in and live in volatile and conflict settings. I think I'd read it before, but just to ensure that it's fully answered.
If it's okay, I'll take a few of them. I did respond to some of those in writing already on the chat, but I'll still answer some of them. And I think the first one I want to take is the one on the call, because I feel like that's a very important one not to be missed. So, sorry, I blanked out on the I wanted to take that one first, but it'll come to me. Never mind. Let me take the 4 questions that were in writing first. So I do think that it's important, in terms of integrated programs, integrated evaluations, it's really important to first understand that you cannot evaluate an integrated package the same way you evaluate individual interventions, right? Because then you're looking at the combined effects of these interventions together on the ultimate outcome. It does not mean a 30-minute survey becomes 30 times 4. It still needs to be a 35-minute survey, right? And we'll have to be really cautious about the time and the burden we put on forcibly displaced populations, which means the evaluating teams and the program teams need to agree on a theory of change and key indicators to evaluate as part of the integrated program evaluation. Now, when we talk about the dissemination of that information, I've noted this in the chat as well. It's incredibly important, and we've identified this even in the report that, looking at innovative ways to actually disseminate that information, not only making sure that all types of audiences understand it, but ensuring that you can take large volumes of data that you've created through these integrated evaluations into meaningful, actionable items is critically important, and the use of technology in this cannot be understated. And I'll come back now to the question that was talked that, looking at the how rapidly the context of these populations change, right? The fluidity of the context is critical, which is why oftentimes RCTs are not feasible. They are neither accessible nor feasible to many of these, in many of these highly volatile country contexts, right? Because we can't control those external factors. That's where quasi-experimental evaluations and evaluations that allow programming to change depending on the context is critically important. There was an evaluation we did in Thailand, not a fragile context evaluation, a very stable context evaluation, a very steady evaluation. Even then, the program changed significantly between baseline and endline, the 3 years during which we were evaluating it. But a good evaluation always makes concessions for those things. There is no way that's where the qualitative component adds a lot of value. Things like outcome harvesting, looking at mining those outcomes, focusing on storytelling, and really understanding how and why change was brought about or was not brought about becomes incredibly important, right? That's where you can have a solid quasi-experimental approach. You have the power to estimate impact and you still don't, but you can explain why not. And that should still be an option. Evaluation needs to be seen as a learning experience, not as a demonstration of success. If we look at evaluations as a demonstration of success, we don't learn from them. And it's incredibly important to understand and use that as an opportunity to showcase to our partners, to our donors, that implementing in these contexts is challenging, and that's why more resources are required to be able to sustain, not just generate the impact, but also sustain those impacts over time in these contexts. I think that I also answers another question that there is on the chat. Now, regarding the question on, sorry, I'm going to go back to the Q&A. There was another question I'm missing. It was on the social cohesion aspect again, right? That there's a blur between forcibly displaced communities and the hosts because there are efforts of forceful integration in the host community. I'm not sure exactly what context this refers to, but oftentimes displaced persons are not welcome in host communities because the perception is that they are piggybacking on, or the already thin resources in many of these countries are being spread further. That's why when we come in with interventions in these contexts, it becomes really important to ensure that we are making change not just for forcibly displaced persons, but also the communities that they live in and live with, which is why social cohesion is more important. I'd be happy to take this up as a chat later. Perhaps a little bit more context would help me answer, Konjit, your questions, but I would be more than keen to do so later. Sorry if I've missed a question, Innocent.
No, I think that's you didn't miss it. The next 2 questions are more for Edward, Tasha, myself, but I'll still read them out. There's one from Barry that says, how can we expect impact with limited funding opportunities to support host communities and IDPs nowadays? That's a general question, you know, regarding the limitations in funding and impact. And then there is another question from Claudia that's also directed to Edward and Tasha. These are often difficult evaluations to launch in an organization which requires a lot of work with program colleagues, including to entice them to input their time and effort into facilitating this type of evaluation. So how do you navigate potential reticence from the evaluation users to convince them of the importance of this type of evaluations for future programming? What was overall the length of duration of the IFA assignment? In other words, how long did it take? And can you clarify what will be the next steps would be? So I guess that's more to, you know, to the evaluation managers.
I think I can take the last one. Thanks, Innocent. And just to wrap up also, I replied in a little bit more in detail in the chat to Claudia, to the last one. But just to add to this, the next steps for the FA is that, so basically it's different angles. No, the next steps are the integrating the learnings and the methodology of the impact feasibility assessment for us. No. But also then continue the work with the programs and stakeholders and partners that this has triggered this process of the IFA. For example, there is already that's conversation to conduct to implement an impact evaluation building on the case study of Jordan that has been published in this IFA. And then we're initiating our conversations also, as I mentioned before, with UNHCR and ILO evaluation focal points. We have to see if others might join, but basically to explore the possibilities of working together on this, building on the learnings of this exercise and other information available. No, so I think the IFA, to put it in different words, concludes here. It's an impact feasibility assessment. No, it's to assess. No, feasibility is a little bit compressed. The answer in what Preksha mentioned in the lessons at the end of her presentation. So and basically just we are disseminating the information and the learnings from this exercise, and also making available the impact evaluation designs of these 4 cases, just in case they can be adapted for similar ones, or they can be taken forward, particularly if the countries want to commission about impact evaluations using this information, as is the case of Jordan right now. No. And I think we will have to stop here. We're already passing 6 minutes, the time. I would really, I'm very pleased for the exchange that has taken place so far. And thank you very much for the participation of everybody. We are going to share the recording of the session. And again, we're going to share the presentation and the publication, the 7 reports that have been published here. Thank you so much, and please don't hesitate to contact us, myself, Innocent, or Preksha and Jose, for anything you might want to suggest, comment, or share. Thank you.
Thanks, everyone.